Hello YouTube, welcome to Dr. Vibes, a learning point. This is the part 2 of the pathophysiology of a burn wound. This is the part 2 of the pathophysiology of burn wound. In the first part, we have studied the burn wound model given by Jackson. And here we will study what are the systemic responses that occur after a burn. Now, you should know there are some mediators of burn pathophysiology. Those are your histamines, prostaglandins, leukotrienes, thromboxanes, nitric oxide, angiotensin 2 and ADH. Okay, now what will happen to the cardiac system? There will be decrease in cardiac contractility, there will be decrease in venous return, which will cause decrease in preload, and there will be increased afterload because there will be increased systemic vascular resistance. So दो चीज कम रहा है, एक चीज बढ़ रहा है, contractility और preload कम रहा है, afterload बढ़ रहा है. Pulmonary. What will happen in the pulmonary system? There will be direct inhalational injury, there will be increased pulmonary vascular resistance, and obviously you know that in burns you get to see edema that occurs because of increased capillary permeability in the lungs. In renal system, the perfusion will be decreased, so urine output will also be decreased. देखो इन सबको रटने से better है, you should think what happens to a burn patient. Consider there is a burn patient and what will happen? Metabolism क्या होगा? Initially the metabolism will be decreased for the first 24 to 48 hours. Then the metabolism itself start increasing. Why? Because of hyperdynamic circulation. Because there is expenditure of protein storage in the body. What will happen to the GI system? There will be mucosal ischemia. सब जगह ब्लड कम जा रहा है क्योंकि हार्ट कम ब्लड पंप कर रहा है. जैसे रेनल में परफ्यूजन कम हो गया, GIT में इशेमिया हो गया. There will be stress ulceration due to burns which is called as Curling's ulcer. Stasis of peristalsis, मतलब peristalsis रुक जाएगा. There will be increased permeability through the bowel wall which will cause translocation of the gut bacteria and that can cause sepsis. तो infection होगा. And there will be a calculus cholecystitis. तो इशेमिया हुआ, ulcer formation हुआ, septic infection हुआ. In periphery, you will get to see compartment syndrome. I will make a video about it in details. Okay, this is a very important question, that why do edema occurs in burn? The pathophysiology remains the same, that there will be increased capillary permeability, there will be increased hydrostatic pressure, decrease in the plasma oncotic pressure, and there is impaired cell membrane function. Lastly, what happens to the immune system? Your cell-mediated immunity will reduce, so the chances of infections will increase. And also, burn हुआ है, जो skin barrier है, वो destroy हो जाएगा, and this will aggravate the process of infection because organisms और जल्दी घुस जाएंगे. So this was about the systemic responses that occur in a case of burn.